America's mental health mess, a crisis hiding in plain sight. It's 2025 and getting help for your brain is somehow harder than getting a ticket to a sold-out show. New 2025 rules promise parity, telehealth expansion, and more community clinics. But will it be enough? This video breaks down why care is failing, and what might actually help. Right, let's talk about mental health care in America, or more accurately, let's talk about the absolute dumpster fire that is currently passing for mental health care. It's 2025 and getting help is somehow harder than getting a ticket to see a unicorn play a sold-out show at Madison Square Garden. We have phones that can order us a pizza, a taxi, and a life-sized cardboard cutout of Ryan Gosling, yet finding a therapist who is in your insurance network and accepting new patients feels like a quest from a fantasy novel. This isn't just a small problem, it's a full-blown crisis hiding in plain sight, affecting millions of people who are told to just breathe or go for a walk. Let me be clear, this is a system that is fundamentally, spectacularly broken. It's a labyrinth designed by a sadist, where the prize at the end is basic human wellness. You call your insurance company, they give you a list of doctors. You call the doctors and guess what? Half of them don't work there anymore. A quarter of them aren't taking new patients. The rest have a waiting list so long you could finish medical school yourself before you get an appointment. So, in the face of this five-alarm fire, what are the powers that be doing? Well, there is a new plan for 2025. It has a fancy name. The Mental Health Parity and Addiction Equity Act Enhancement Initiative. The main idea is to finally put some teeth into those parity laws. Insurers will have stricter reporting requirements. They must collect and submit data proving they are not being sneaky. For example, they can't have a massive network of heart surgeons but only 3 in-network child psychologists for an entire state. The government will increase funding for community mental health centers, often the only option for low-income people. A key part of the update is expanding telehealth, making permanent many emergency measures that improved virtual access. This could be a game changer for people in mental health deserts where the nearest therapist is hours away. Finally, there's a push for integrated care. Mental health professionals inside primary care offices so help is immediate and routine. But telehealth isn't perfect. Not everyone has reliable internet or private space to talk. And the biggest issue remains the workforce shortage. You can pass laws, but you can't instantly create therapists. So here we are in 2025 with a crisis that's been brewing for decades, and a new set of plans that offer a glimmer of hope, but no guarantees. First, we need to get serious about building the mental health workforce. More funding for education, training, and loan forgiveness for those who serve underserved areas. Make mental health careers financially viable so people actually choose them as long-term careers. Second, simplify the system. A single clear pathway to find and pay for mental health services with real-time provider availability. Third, keep talking about this, loudly. Crush stigma. Treat mental health like the public health priority it is. Pressure business leaders and politicians. Frame this as an economic, educational, and community issue, not a niche problem. Invest in schools, families, community clinics. Build supports that stop crises before they start. The 2025 updates are a start, but they are not the finish line. A system that doesn't just promise help, but actually delivers it. Everyone deserves to be well. If you care, call your representatives, support local clinics, and keep this conversation going.